Aboriginal and Torres Strait Islander health workers belong to a unique profession, one which truly reflects the Aboriginal and Torres Strait Islander view of health. That is, not just physical health, but the spiritual, emotional and cultural well-being of the whole community. The formation of NATSIHWA in 2009 was an important step in acknowledging the significant role that Aboriginal and Torres Strait Islander health workers play in helping to close the gap in this country. The association aims to lift the profile of health workers and achieve recognition for their role as a vital and valued component of healthcare teams. Jenny Poelina is the association's chairperson.
And I hope that this is going to be an opportunity for information sharing in the work that NATSIHWA does. Thank you. My name is Jenny Poelina. I'm the Senior Manager for the Centre for Aboriginal Primary Healthcare Training, Education and Research, so CAPTA, with the Kimberley Aboriginal Medical Services Council in Broome. CAMPSC is a regional body that provides specifically Aboriginal health worker training and Aboriginal primary healthcare training. So, we also provide training for med students, doctors, nurses, nursing students do pracs within our services, and a whole range of other training and research. Some of the research stuff is around the evidence-based practice for best practice. Around some of it's around diabetes, smoking, and there's just a whole range of things that are going on. And you get a woman from the Fitzroy River area, from Derby more specifically, and I've been working in Aboriginal health since I was 16 and a half. I think the most important thing for me is that health was in my lian, so this is my spirit. So as a child, I was the one that put the band-aids on my siblings and my cousins. I was the one that used to be concerned about people, kids being safe. So, climbing trees, growling them. And so for me, it's always been there. And I mean, my mum came from a health background as well. So that was kind of like a reinforcement. And for us as Aboriginal people, we learn to be connected to our lian and how that's going to guide us. The role of the Aboriginal health worker in closing the gap, for example, for Aboriginal and Torres Strait Islander peoples is absolutely vital. We used to be the Jackies, the liaison officers, the interpreters, but a lot of our people haven't had good access to decent healthcare. And so I believe my thing is that Aboriginal health workers are closing that gap around access, and it's very important for our people that they feel comfortable when they're being cared for, that they know that people understand where they're coming from, what their family structures are, and who they belong to. With primary health care, it's around all of those things. And it's really, really important that Aboriginal health workers have access to, nationally accredited training, that they have the capacity to be registered as health practitioners if they wish to be, or if it's part of their employment. And in caring for Aboriginal people, I believe that Aboriginal health workers are absolutely vital. In the Kimberley, we actually deliver 4 main qualifications. So in the Certificate 3 is around being able to provide basic health assessments, so to be able to do a health assessment and to understand why our people are so sick. We are very strong on looking at the history and where our people have come from and where they are today, and the impact that that's had on our people's health. So we do senior first aid. We also talk about, we start talking about early detection of illness, so diabetes and heart disease, and also the child health stuff and the maternal health stuff, so that we know that, mums need to be healthy to have healthy babies, and also the prevention with the immunisation. So it's part of the Certificate 3. The Certificate 4 becomes a little bit more complex in that health workers learn about medicines, how they work on their body, what are common medicines that get used for common diseases, and actually how to administer those medicines. They also learn how to deliver primary healthcare programs, so diabetes programs, child health programs, for example. They can actually work in specific areas. They learn about nutritional stuff and the value for needing special food for, particular illnesses. And in the Kimberley, we teach Aboriginal health workers how to take bloods and other specimens required for pathology. And a certificate for health worker can work kind of independent but with limited supervision. So obviously as part of the team, Cert 3 health worker needs to be supervised. And in the Kimberley, our health services prefer to have health workers with qualifications, with knowledge and skills at the diploma level, because they can work more independently and therefore have more use in a sense of that they're able to do other things that is not requiring supervision. So in the diploma, we teach Aboriginal health workers how to manage things a bit better. So how to manage program work, how to manage primary healthcare type things, how to supervise and support their peers and or students. We also teach some really advanced skills around applying primary healthcare. So, stuff around ECGs, being able to suture, for example, because, we often don't necessarily have the medical staff within our health services that that might be able to do those things, i.e. doctors and nurses, because traditionally that was part of their roles and responsibilities. And things like, emergency things, being able to insert a Goodell airway and to really be able to do those on-the-ground emergency type needs that might happen. And we also do training around social emotional wellbeing, so that we have a more clear understanding about where people are coming from, so that health workers can understand that extension of that whole primary healthcare for the whole body. What else do we teach into the diploma? And we give them skills around like human resources, so that they can understand what contracts look like, people's duty statements. They might be responsible for employing people, so it's important that they have an understanding around that HR stuff, managing meetings, community development, health promotions. One of the units in the core or compulsory is to be able to manage medicines, and camps recognised many years ago that Aboriginal health workers working in a remote area needed to work really safe with medicines. So they developed a little training course around being able to work independent and be on call at night in remote areas. So we have standing orders, and they're problem managed standing orders. So a problem presents and this is how you manage it, and it might need a medicine. So we make sure that health workers have got really high level of skill and knowledge around those medications. And of course, we have to have public indemnity and insurances and all those sorts of things. And so we've been delivering that for a number of years. And we also now deliver at an advanced level renal care skills. So we actually have Aboriginal health workers working in our satellite dialysis unit in Broome, where there are 10 chairs and 40 people dialysing. So they're taught all about renal disease, the burden of illness, how to connect somebody with a dialysis machine, how to look after people with peritoneal dialysis, and anything that encompasses around the renal care, pathology, the results, the importance about fluids, and you can't overload. People have to be reminded that they can't overload their body with fluids, and how much fluid's got to come off when they're on the machine, and it's it's a tertiary healthcare. And the model of that came out of the Northern Territory, because there was a lot of our people that were going on the dialysis machines. It's better care for them if they have an Aboriginal health worker as a main part of the team in caring for them, so that they feel more comfortable and they're more likely to be more compliant as well. I don't think many people know what health workers do. Particularly in mainstream health services, and of course general practice. And some of the things that have been, being implemented in health education, for example, is that there are now units of Aboriginal health, and the roles and responsibilities of Aboriginal health workers, I believe, should be embedded in that, because then when people are learning to be another health professional, they're doing another career path, at least they understand then what an Aboriginal health worker does, and that they realise that they're absolutely integrated and they're vital for providing primary health care to Aboriginal people. So, you know, for a doctor, for example, if they decide that they want to be work in Aboriginal health, then they've already got that early knowledge around the responsibilities and the roles of the Aboriginal health worker in the care of the client. For us, it's about what's in our lian, and that's the strongest thing. And so our young people need to, it's very important for them to have connection to their Aboriginality and, you know, all of their connections, because sometimes what we find is that young people might think it's a good idea to become an Aboriginal health worker. They start the training and then they get frightened and they think, oh gosh, this isn't what I wanted to do. So we've been promoting Aboriginal health worker career paths within the schools as well. And we talk to our young people about, you know yourself what's in your lian. You know that, you know, some kids are artists, some kids are teachers, and some kids are musicians, and some kids are got that health lian, and we really support that and the community supports it too. And the communities usually know they're sort of like family connections. Like you'll often find that there'll be 3 or 4 generations of people, Aboriginal families within the structures that have got that health background traditionally as well. So that's what we really support. And the other thing that's really important, I think, is that, you know, school curriculums need to be really, really strong about 2 things: Aboriginal history and health generally, so that not only Aboriginal people kids can make wise decisions about making sure that they stay healthy, but also that the mainstream population also understands about all of that stuff and access and those sorts of things as well. And an example of what we're going to be doing, or we're hoping to be able to do very soon, is we're going to trial a training program that works very, very close with a particular remote community and the healers of that community, where the community will choose who the participants will be. We will provide them with what I'm calling mainstream training, which is the national training package. And so we'll go in like for a week and then into the community so that people don't have to get humbugged when they go to town. And then the traditional healers will also have time with these individuals and talk to them about bush medicines and whatever practices they need to do. So we're going to do it and we're going to roll it out. And we're going to see how it goes. And if we see that it's a very good model, well, then we'll start promoting it. It's just something that we're just trialling in the Kimberley. I have faith that it will be the perfect model, because those particular communities still use bush medicines within the clinic, so we support that to ensure that that's, we try and make sure that that's the first choice of medicine, so to speak, is the traditional stuff first, and then the mainstream or Western medicines, yeah. Non-Aboriginal health worker health practices, so, you know, those other health roles like doctors, nurses, health work, physios and speechies and all of that sort of stuff. I think it's really, really important that every one of them, that it's compulsory for all of those training, whatever they are, packages or, university degrees. If it needs to be embedded in that about Aboriginal health, and the what, the who's and the whys and the what's around it, because people might think, oh well, I'm going into mainstream health, I probably won't have to look after an Aboriginal person, but they don't know just by the colour of the skin whether somebody is Aboriginal. And for those of us that have fairer skin, it's very important not to assume that we don't know our Aboriginality and not consider our cultural needs. It's Aboriginal health in our hands, for our people, by our people, and I think it's absolutely vital.